Hi, my name is Tiana Karamayas and I'm a Cavoodle puppy coach and breeder for Noodle Way and River City Puppies. As a coach, my philosophy is simple. A Cavoodle should always complement your lifestyle, not complicate it. And this is the foundation to everything I teach. For almost the past decade, I have been working in the breeding, training, grooming, and veterinary sectors of the small animal industry. I've also been raising Cavoodles for the past 16 years, so I have definitely learned a thing or two about the breed along the way. Now this podcast is all about Cavoodles. Raising Cavoodles, training Cavoodles, grooming Cavoodles, breeding Cavoodles, and how to shape the behaviour of a Cavoodle puppy. So, if you're a Cavoodle parent or you are looking at adding a Cavoodle to your family soon, then this podcast is for you. New episodes will be released each Tuesday morning, and you can follow me across all social media under the name @OodleWay for more tips and advice on Cavoodles. Thanks for tuning in. Hello, and welcome back to episode 36 of the Cavoodle Coach podcast. My name is Tiana Karamayas and I'm your host. I have tried to record this episode 4 times already and it's just not coming out the way I want it to. And I feel a little bit more pressure than I usually do with this episode, just because it is quite a heated topic of debate amongst dogs in the animal community. And I want to make sure I'm getting my perspective across correctly, just so everyone understands my point of view as well as they can through a podcast. So 4th time, hopefully this is the actual time I can actually complete this episode in full. So in today's episode, what I want to be doing is I want to talk about desexing our dogs, and I want to talk about when we should desex our Cavoodles, in my opinion, and also how we look after them post-surgery to make sure that they are very comfortable and recovering well. So let's start off with when I recommend desexing a Cavoodle, and then we'll jump into the after-surgery care. So last week, I took Joey to the vet and he got desexed, and he is 6 months old. And the reason why I chose to get him desexed at 6 months old is because of all the hormonal changes that he's about to go through, and the fact that these hormonal changes can completely affect your puppy's personality, and it can create some really big regressions in their training, especially for little Cavoodles. Now, let me delve into this a little bit more deeply. When we talk about the topic of desexing, there is a lot of noise out there. There is a lot of people who recommend 6 months to get your dog desexed, a lot of people who recommend 1 year of age, a lot of people who recommend 2 years of age, and then you have a lot of people also who just don't recommend desexing at all. What I want to say is your decision on whether you should or shouldn't desex your dog is entirely your decision. I will just say we don't want to see any accidental pregnancies out there. So if you're not desexing your dog, you're going to have to take some extra measures every single heat cycle to make sure your little female doesn't get pregnant, or if you have a male, they're not escaping your house to get to the females. And also your decision on when you're going to desex your puppy is completely up to you, and it should be based on your vet's recommendation for your puppy. If there is a medical reason as to why your vet is recommending that your Cavoodle doesn't get desexed until 1 year of age, or if there's a reason why your vet is recommending 6 months of age, definitely take this into consideration, because they're looking at your puppy in particular, and you're not just taking the advice of someone online who has never met your dog or even looked at any sort of medical history there. So just take this episode as maybe an educational episode, and then go and make your own decision based on your personal opinion and your vet's recommendation. Okay, just getting that little bit out of the way. Okay, so desexing Joey, why did I do it at 6 months? Like I said, it's because of those hormonal changes. And what we see with Cavoodles is Cavoodles are very, very anxious. They're prone to anxiety. And so to prevent that anxiety from forming in Joey, I have spent weeks upon weeks upon weeks being very intentional with all of the training, all of the socializing, all of the desensitization that I have been doing with him to teach him how to regulate his emotions, and also to teach him how to feel confident within himself. The more confident a Cavoodle feels, the less anxious they feel. And we have made such amazing progress with Joey. He was a very nervous little puppy. So at 8 weeks of age, he was quite nervous and very, very shy, and he would retreat into himself anytime someone was around him. And so we have spent 4 months building that confidence, and now he runs up to people to say hello. He listens very well. He's able to go out in public and stay calm, and we have just made such amazing progress with that confidence, and he isn't suffering from any anxiety. But what I didn't want to see is for his testosterone to come into play and for that to completely change this. When your puppy reaches 6 months of age, that's when the hormones change. For little boys, the testosterone completely spikes. And when they have a really big spike in testosterone, what we can see happen is they can become a lot more territorial. And so maybe your puppy was very comfortable with people coming to your house, but then they have this big hormonal change with their testosterone, and now they start to bark at everyone who enters the front door, or they bark through the window at anyone walking past your house. That is because of these hormone changes. And when your puppy is barking, that is a reflection of the anxiety that they start to feel. And so those hormone changes can create that in your puppy. Similar to this, maybe you have been taking your puppy on walks, and they have, like Joey, and they have been walking on a perfect loose lead. They don't bark at people, they don't bark at dogs, they're completely comfortable and relaxed, and they're very attentive and focused on you on the walks. But then the hormones start to change, and now suddenly they pull on the lead, they bark at people, they zigzag everywhere, their focus is entirely gone, and now they are not staying very focused and calm and attentive towards you. So those hormonal changes can definitely affect your puppy's overall personality and demeanor. And I personally did not want to take that risk with Joey. Now, Joey at 6 months, he has no medical reason as to why he was unfit to be desexed. And so because of that reason, and because of the fact that he's completely healthy and there's nothing wrong, I chose to get him desexed at 6 months to make sure that all those hormonal changes aren't going to cause any regressions on his training. Now, what I will say is I have definitely, in the past month before Joey's desexing, I have definitely noticed hormonal changes in Joey because that rise in testosterone, it's not just a bam, he's 6 months, let's spike it now. It's a bit of a gradual process. And so as they start to go, 4 months old, 4.5, 5 months, 5.5, that testosterone slowly starts to rise. It's like a big wave. It slowly starts to get bigger. And so I was noticing these changes. I was noticing Joey was becoming a lot more reactive in the home towards people who were walking out front of the house. On the lead, he was starting to bark a lot more on the lead, which he wasn't doing when he was younger. The training stayed the same. We were doing all of our normal routines. We were doing all of the same desensitizing and the socializing and the training, but he was reacting differently. And when you look at this, and you look at this from a case study point of view, if your training has stayed the same, nothing has changed about the puppy, we can we can definitely look at we can definitely look at what's happening internally as maybe a factor contributing to this. And I knew that he was going through these hormonal changes, and I could see that being expressed through his behavior. So that just alerted me even more that it was important to get him desexed at 6 months if he was fit and able, and he was. So when it comes to looking at your Cavoodle and whether or not you should desex them, just keep that in mind. Keep in mind the hormonal changes. Keep in mind how that can change your puppy's personality, and then take that into your research and make your decision with that factor in play, because it's very important. Every dog is going to go through those hormonal changes at 6 months of age, and for little female dogs, they'll go through their first heat cycle also at around 6 months of age, and that can take weeks and weeks to recover from just because of the big hormonal change there. So something to keep in mind when looking at desexing your Cavoodle. So that's why I desexed Joey at 6 months. I don't want the hormones to change the training and the little personality he has, and I'm very comfortable with my decision. And now I want to talk about what I did, or what I am doing, because we're currently in recovery, for Joey post-surgery, and then also maybe a few tips leading up to surgery on what to do. So leading up to surgery, one of the first things I recommend doing is going onto Amazon and purchasing a dog recovery pillow. So what this looks like, it's like a neck pillow that you would take on a plane, but it's for dogs. And it just is like a little inflatable pillow. It goes around their neck, it clips up, and this is so much more comfortable for them than the big plastic cones that the vets would give you post-surgery. So I definitely recommend getting a recovery neck pillow for your dog, just so your puppy is more comfortable in the days after its surgery procedure. What I also recommend doing is organizing some time off work. Now, when your dog gets desexed, whether they are male or whether they are female, they are going to have stitches, and we have to make sure they don't rip those stitches open. And so your puppy cannot be running around. They cannot be jumping onto couches. They cannot be running up the stairs. They have to be kept very, very quiet. They're not even allowed to go on walks in those first days after surgery. So it's really important that you take some time off work so you can be there with your puppy to make sure that they're staying very quiet. It's also important to keep in mind that if your puppy has a cone around their neck or the recovery pillow around their neck, they're definitely not going to be able to fit through their doggy door to get out to the toilet. So you need to be home to be able to open that door for them so they can go outside and do their business. So organizing some time off work is also very important for your puppy when they're getting desexed. Now, before you take your puppy to get desexed, the night before, they are going to have to fast. So usually the vets will recommend giving your puppy their last meal no later than about 8 p.m. at night, and then taking away their food. And then overnight they can have access to water, but then once morning comes around, taking away their access to water as well. It's then important to take your puppy to the toilet, and then you can head off down to the vet. Now, usually they admit the puppies into the clinic at around 8 a.m. when the clinic opens. So again, you'll need that day off work to be able to take them to the vet. So we'll take them in at 8 a.m. Your vet will go through just some information on what to expect. They'll give you maybe some documents to read over, and then they'll take your puppy out the back. Now, it can be very nerve-wracking taking your puppy to the vet for a surgery for the very first time. But what I would like to say is I used to work in a vet clinic. We had puppies coming in every single day for desexing. And I will just say that the puppies get so much love from all of the nurses and all of the vets. Not only are they obviously adorable, so everyone wants to cuddle them, but everyone in the clinic is aware that it probably is your puppy's first time in the surgery room or in the back ends of the theatre. So what they want to do is they want to make sure your puppy is as comfortable as possible. So your puppy is going to be showered in love and showered in cuddles and attention. So they are going to be okay. If you have crate trained your puppy, this is going to make them so much more comfortable because they're going to be sitting in a crate out the back. So if they're crate trained, it's going to just limit another increase in anxiety just because of being in the vet clinic. What I did for Joey is when I took him to go get desexed, I did take him his favorite toy. I did take him his personal crate that has his little blanket in there, and the vet clinic took that all with him out the back, and they put it in his cage with him. And so that gave him just, a little bit of comfort because he had his familiar toy and familiar smells around him. So that's also a good idea when you go to the vet. When you take your puppy to the vet, what the day is typically going to look like. Now, I'm speaking from my own experience when I was working in a clinic. Some clinics might differ from this, but usually the flow of events for the day is your puppy will be admitted to the clinic for the day at around 8 a.m. Over the next couple of hours, they usually will have a blood test just to make sure that everything is normal before they go under anesthetic. Then your puppy will be given their pre-anesthetic, which makes them really, really drowsy. During this time, the vet again will make sure that everything is okay. They'll make sure the surgery is ready for the puppy. They'll start hooking them up. They'll start shaving up the surgical area. And then your puppy will be put under the full anesthetic for the surgery. For desexing, the surgery is very, very quick. It's very straightforward. Your vet will do this, like I said, like every single day. So it's a very straightforward procedure. And then while they're under anesthetic, this is usually when the puppies will get their nails trimmed, maybe their anal glands expressed. Just because they're asleep, we might as well take advantage of that. And then your puppy will go into recovery. From recovery, they'll wake up from surgery. They'll be very, very drowsy. The nurses will be all over them, checking their temperatures, making sure their breathing is right. The pain medication will be administered, and your puppy will pretty much just sleep most of the afternoon until you pick them up. Usually pick up for your puppies is from about 2 p.m. onwards, depending on what time they went into surgery for the day. So the actual flow of events for your puppy is very, very straightforward. Like I said, it's a very common procedure to get desexed, and the vets do make them as comfortable as possible because when they give them the pre-anesthetic, your puppy can be a little bit drowsy, and it can help make them relax before they actually go into surgery. So the vet then calls and says it's time to come and pick up your puppy. Everything went well. What do we want to do? Well, we're going to come down to the vet and we're going to go through a lot of post-op care with the vet. And I'm going to share just some of the things that my clinic gave me for Joey. And this is pretty standard across all vet clinics on what to expect. So I'm going to read off my little post-op care sheet that the vet gave me for Joey. So the first thing to keep in mind is when your puppy has had surgery, they've had anesthetic, and it's going to take them about 12 to 24 hours for that to fully wear off. And during that time, what we're going to see is our puppy is going to be very drowsy, and this is completely okay. It's also completely okay if our puppy doesn't want to eat dinner and if they don't want to drink any water. When they were in surgery, they did have fluids, so they are very hydrated from that procedure. So it's not essential they drink water that first night, but it is essential they start drinking water the next day. In terms of the food, what we want to do is that night, after the surgery, we offer them half their normal food. Again, if they don't want to eat, it's not a major concern, but on day 2, we definitely want to see them start to eat again. After that 24 hours, what we'll see is our puppies will start to come back to themselves. Their personality should be back. They'll wake up in the morning and they'll be buzzing like a little jelly bean. And this is when it's really important that we are keeping them very, very quiet. That first day, they probably are going to just sleep most of the afternoon, and that's completely normal. Now, that next day, once they wake up, what we're going to do is we're going to make sure, of course, that cone or that recovery collar is on our puppies. That needs to be on 24/7. We can't have our puppies licking their wounds because that can make this little surgical sites infected, and they can also pull out their stitches, which we obviously can't have them do. So make sure your puppy is not licking themselves, but it is important that you are keeping an eye on the surgical sites. Where your puppy has their little sutures, we want to make sure it's not red. We want to make sure there's no discharge, no blood. If there is, it's important to contact your vet straight away, just so they can have another look at that little surgery site and make sure the wound is actually okay and that there's no complications. With the wound as well, we're going to have to give them another dose of pain relief. So typically the pain relief comes in the form of some little tablets. Here in Australia, a very common name for the medication you get is called Medicam. It's a very common pain relief, and usually you give them just a little tablet once a day for 3 days just to help with their pain relief. And this tablet, it's when they're having this pain relief, it's very important to make sure that we're not seeing any vomiting. And if they have the diarrhea, that it starts to clear up within 3 days. If it's not, and if it's persisting, you have to go back to the vet, because sometimes, depending on the pain relief you're on, sometimes it can cause upset guts for your puppies, and it can even cause stomach ulcers. So if we're not seeing that diarrhea start to clear up within about 3 days, go back to your vet. And if there's any vomiting, obviously give your vet a call straight away. But that pain relief is going to take away all pain. So your puppy will be completely okay if you keep that up for them. What I recommend doing is, because our puppies can't have any exercise, they can't be running around, they can't be playing, it's a really good idea to pre-prep a little bit of enrichment for them. So some enrichment activities that are very solitary, not solitary, maybe, I can't remember. My mind just went blank. Well, they're not going to actually be walking around. So things like a licky mat or a puzzle or a Kong, these are good things to pre-prep for our puppies, because it's going to be enriching, it's going to entertain them, but our puppies aren't going to have to jump around to chase after a ball, for example. Now, when you are giving them these enrichment toys, it's also really good to not give them anything rich in flavor, because that can lead to an upset tummy. So rather than doing something like maybe peanut butter in your Kong, maybe you can switch it to some boiled chicken and rice. Just something very bland, but still yummy, just so we can avoid upsetting the tummy further. Because again, your puppy has been under anesthetic for most likely the first time. And so we want to make sure their body is recovering properly. It's then also really important that you do attend your post-op checks. So usually you will have a post-op check 3 days after surgery and then 10 days after surgery at the vet. So make sure you go to them. They'll check the wounds. They'll make sure everything's healing correctly. And then they'll also tell you when it's time to take the cone off and your puppy can go on their walks again. Now, that's pretty much essentially what the post-op care looks like. We're going to be making sure our puppies are very quiet and they're not doing anything that's going to exert them or stretch their stitches. We're going to make sure that they're eating properly after that first day. We want to make sure they're not having diarrhea for more than 3 days. We want to give them their medication for their pain relief. And then they heal really quickly. Puppies, they bounce back so quickly, and they will act like they never even had surgery within usually 24, 48 hours. So the recovery is so quick. It's such a straightforward procedure, and usually there are very little complications, but it's always important to keep a close eye on your puppy, and that's why I recommend just taking some time off work so you can be there for them. It'll also give you some peace of mind, because I know how stressful it can be sending your puppy off to surgery for the first time. So that's about it. That's about all I have to say about desexing. We talked about why I chose to desex Joey at 6 months. It's because of those hormonal changes and how those hormones can change your puppy's personality and definitely increase anxiety within Cavoodles, and I don't want to see that with Joey. And then we talked about some care for our puppies, both pre-surgery and post-surgery, what to expect. But yeah, then your puppy will be desexed, and then we can carry on with all of our normal routines. So we want to continue with our socializing, we want to continue with our desensitizing, we want to continue with all of the enrichment, all of the behavior shaping that we're doing previously. We're just going to take about a week off just for our puppy during that desexing time. So I hope you found this episode maybe very educational, maybe a bit reassuring, and I hope you enjoyed it. And I am excited to come to you next week with another episode. And if you are getting your puppy desexed, just take this as your last little tip to know that you're going to be much more worried than them, and you're going to be much more stressed than them. So it's really important, as much as possible, that when you bring your puppy home, that you stay very relaxed and very calm, and that's going to reassure your puppy that everything is okay, because they are going to be feeling different, especially those first few days after surgery, and we don't want them to think that something is wrong, which will give them a reason to stress, which can definitely cause diarrhea in itself. So make sure you stay very calm, follow your vet's direction, and everything is going to be okay with your puppy. Okay, so that's it for this episode. Thank you for listening. Thank you for tuning in. I really appreciate it. And I will see you in next week's episode. This has been your Cavoodle coach, Tiana Karamayas. I'll see you later. Bye.